Good evening, everyone. I am Richa Sehra, founder and editor-in-chief, Responsible Hospitals, and today I would like to welcome all of you on our Insta Live channel. As you know, that I always come up with a different kind of topic, and today's topic is all about the dental issues, and the major known is root cause. So RCT is something which is treatable, which has a lot of significance, and people have n number of questions related to the same, and we're going to talk about it with Dr. Ankur Gupta with us. He's an orthodontist and a consultant, quite well known in Gurgaon, and he'll be with us live soon. So as soon as I am able to add him, I would request you all to have some questions related to it, and you can just ask us during the session. So just give me a moment so that I can just add him. Dr. Gupta, if you have not followed Responsible Hospitals yet, I think there could be an issue. So you just need to follow that first. I think that will help you to add yourself. Can you hear me? If you can hear me, then just wave a hand or something like that. I will just try to add you once again. Can you see me? I'm just trying to add you again. Sometimes these all, problems occur very. Yeah, I can see you now. Probably it's showing waiting. Yeah, hi. Can you see me? Can you hear me?
Yes. Am I audible?
Yeah, hi, Dr. Gupta. How are you doing?
I'm fine. How are you?
Can you hear us clearly?
Yes, I am
There's
able to hear you
little.
clearly.
Sure. So, Dr. Gupta, we'll quickly start because people are waiting, and I think let's start the session so that they can just start joining us. So, first of all, I really want to know that I don't know if there is a difference between orthodontist, dentist, and dentist. Is there any terminology behind it? Because we call it in our language that we need to see a dentist when there is a dental issue.
Actually, dentist is a common term. Like everyone who has finished his 5 years of training in dentistry, BDS, is known as a dentist. But
Okay.
after that, there are some specializations like orthodontist, which is the specialty for the braces, then periodontist, that is for the gum surgery, then endodontics for the root canal treatments, and oral surgery for other things. So for that, another training for 3 years is needed. So for after that super specialization, we are called as orthodontist or endodontist or something. So every orthodontist is a dentist anyways, but not every dentist is a orthodontist or endodontist.
Got it. Sure, sure. So, doctor, as you know, RCT is something dental issue. So, how does it happens to be? I mean, how does this process follows? So, let's suppose somebody has a pain in the teeth, any of the teeth. Is it always, sure that they need to get RCT done, or this is the only way out?
Usually, there are some causes of the pain. We need to see those causes. Like if the patient comes, we diagnose that thing with the X-ray and the clinical judgment. If we find that infection has reached inside the nerves and the pulp, blood vessels of the tooth, then we will definitely need the root canal treatment or RCT. But in some cases, it can be because of some gum problem also. In those cases, RCT is not needed. So that has to be diagnosed clinically and with the X-rays. So in most of the cases, like if the pain is severe, if too much pain is there, then usually the cause is because of the infection in the tooth only. So in those cases,
And otherwise, you are saying that even the medication can help them to recover. So it is not always required to be done.
In low grade infection, sometimes because when the medication goes into the blood flow, are you able to hear me?
Now,
Are you able to hear me?
yes, I can. I can.
So if infection is low grade, that can be treated with the medicines. But if infection is too much, then we will definitely need to do some definitive treatment for that pain or some infection. So not in every
Sure.
cases medicine is useful. We need to do something.
Sure. So I'm sure now let's get into the point which we are there to discuss. Most of the people have the myth that RCT is quite painful. The injection will happen in the mouth. I don't know. So I think we'll go step by step. First of all, you just say, tell us in your layman language that what is RCT exactly.
Okay. RCT is, uh, like the name suggests, it is the treatment of the root canal of the tooth. RCT's full name is root canal treatment. Every tooth has two parts. One part is the crown portion that is visible in the mouth, and one part is the root portion that is inside the bone.
Your voice is going off in between.
Voice is breaking, or what happened?
It went off. Now it is back. Yes.
Okay, every tooth has two parts, the crown portion which is visible in the mouth and the root portion which is inside the gums and the bone. In that root, there are small canals in which blood vessels and nerves are there. When infection reaches there, then we will need the root canal treatment. So this is the treatment in which we treat the canals of the root and remove the infection from those inside the tooth and fill it with medicines and the fillings. So this treatment is called root canal treatment. In short term, RCT. That is the name.
Sure. And why RCT is performed basically?
Usually, it's not a very big science like the people, they are scared about this thing. We just have to make some excess opening over the tooth and we reach inside the tissue, clean that thing, fill the medicine, fill the medication. Then we'll usually call the patient after 1 week or 5, 6 days and then do the filling inside. The only thing, the scary part is that when we have to anesthetize the area around the tooth, which is infected. But believe me, it is just a myth. RCT is not painful. RCT is the treatment for removing the pain. If the
True.
patient is having pain, this treatment helps in removing the pain of the patient. So it is the other way around. But sometimes the mind gets correlated. Pain is equal to RCT. So they make it RCT pain, RCT to pain. No, if pain is there, then we will do the root canal treatment. So that myth has
True.
to.
Sure. I mean, it's like proportionally. I mean, you have already
I think
pain, and then only
connection
you
is
will see the
unstable.
doctor to remove that pain. Yeah. Sure. So, I mean, my another question to you is that what is the procedure of RCT? How you just mentioned it to us, but if you can just elaborate a bit, probably that will help people to understand more.
I will just explain with some model also.
Yeah.
Like if the patient is having infection in tooth, so he will feel pain. So what we do in the root canal treatment, we make small hole inside this area, and with small fine needles, we slowly remove these infected tissues and clean this area. Then we place the medicine inside the tooth, and after few days we call the patient again, and then we fill that area with this pink, the area which is seen as a pink color filling, that we fill inside it, and over that we place a crown over the tooth. So basically, this procedure helps in saving the tooth. Like once the tooth is decayed, in earlier 20 years back, maybe 30 years back, if someone used to have pain or some problem in the tooth, so dentist used to remove the tooth. So once that tooth is
Right, there
removed,
was no other option available.
that is gone forever. So this root canal treatment helps in saving the natural tooth of the patient, so that he can functionally use it for chewing or maybe for smiling and cosmetic and anything. So this way we can protect the natural tooth, and we need not remove that tooth from that.
So, how do you justify that? What will be the life of that tooth? Will it stay like this, forever? How does it
Okay,
work
I
actually?
will I'm the example. I met with an accident in 1995 when I was in 12th class, like was going to the school bus. My front tooth, I went to the root canal treatment of my front two teeth, and they're still here. So you can imagine from myself also, for last 26 years, I have got the root canal treatment of my teeth and absolutely no problem at all. Only now, while talking to you, I remember that, oh, I also have got the root canal treatment done in my tooth. So
That's
if we
awesome.
maintain them well, we are doing everything our like job perfectly, root canal can stay forever. But we can say that the success rate of any treatment in medical science is 95 to 98%. In some cases, if infection is too much or maybe gum health is not good, in those cases, it might cause some problem later on. But that is why we always say get your dental health checkup after every 6 to 8 months. So that if some problem is there, we can detect it at an early stage so that we
Sure.
can manage that thing in the initial stages only, and it is not blown out of proportion. So it's almost a
Because
permanent.
people usually do not realize that there is a need to go and check or consult about, teeth also. I mean, they hardly go unless they feel the pain or they get any infection.
That is about
Right.
the awareness that is in our country, in India. Anyways, in
Yep. That's
metropolitan
true.
big cities, people are very much aware about their dental health. But because one thing we have seen is that always people think that there are 32 set of teeth. Even if one is gone, we can manage with other teeth also. That could be one thing. Then awareness, one another thing that they are not aware that it is important. Thirdly, financial and economical status of the patient is the education level for that. So
Sure.
saving, huh.
Sure. So, another question to you is that what are the pre-instructions which are required for them to take care before coming for RCT?
Usually there are it's a day procedure, so there are not much instructions which are needed to be given to a patient. But we usually say like if patient is coming to the clinic for the root canal treatment, he should not come empty stomach because we have to administer local anesthesia into the patient. So because of that local anesthesia, sometimes we have to check the pulse rate and BP. So we always recommend that don't come empty stomach to the hospital. Always have a good meal. Then if you are taking any blood pressure medicine or some diabetic medicine, always take those things. Don't skip any medicines. So otherwise, there is no. And in case of some, like if too much infection is there, like too much infection, too much pain is there, sometimes dentists recommend taking antibiotics for 1 or 2 days, and then we perform the procedure. Otherwise, there is no absolute some instructions, pre-instructions for the pre-procedure. Something like that is not never there. It's a normal procedure.
Sure. So my another question which is commonly asked, that let's suppose somebody doesn't feel the pain usually, but while eating they realize the pain and they do not see any cavity when when they see themselves in mirror. Do you think that also requires RCT or
No,
that is
no,
not?
no. Usually, if the patient is feeling pain while chewing only and he's not feeling any cavity also, and otherwise that tooth is totally normal, that could be because of some gum problem or maybe some bone loss around the tooth that is supporting the tooth. Sometimes the bone around the tooth becomes weak, and when we apply pressure over that tooth, that aches. Then it could be some because of some high like change in occlusion or some high point on the tooth. That could cause the pain, like if some patient has undergone some filling or restoration on the teeth, and that filling is little bit high, and when he's touching that might cause the pain. Then there can be one very rare cause. In some cases, tooth gets cracked. It becomes split into two parts, and that thing is even not visible in X-rays also. In those cases, when the patient touches and they touch the teeth with each other, there's too much pain with the patient. That in those cases, when the tooth is split, then we have to remove the tooth only. We cannot do the root canal treatment. So not every case in which pain is there that we can do the root canal treatment. No, it depends on the clinical problem and the exact diagnosis. Not every tooth needs root canal treatment.
And maybe I think, I'm not sure, you can tell us better. Maybe some people say that our, teeth are very sensitive whenever we eat very, very cold thing, quite hot thing, then they feel the pain or realize. So does it also be like it's a problem or is it normal?
It can be because of two things. One, it can be because of like gum infection or maybe some sensitivities because the superficial enamel layer has gone. So what we see, if the generalized sensitivity is there, like if sensitivity is in each and every tooth of the patient, like while taking some cold or hot, in those cases, like these over-the-counter toothpaste are available in the market, those anti-sensitivity toothpastes are available. They might help in those cases. But when we see it like clinically, if we see some special tooth is the culprit, like sensitivity is more in one tooth and another is less, then we might have to do some treatment in that tooth. So I
Sure.
think what was your question? I think it was related to this only, na? You were asking.
Yeah. Because we keep on getting some quite common questions also, so I thought I should just put it up. Then I am just going to take some questions online also. People have asked some of the questions. Yeah. What can be the cause of blood coming from gum while cleaning up the teeth?
Yeah. This is very usually the patient comes and they get scared that doctor, my blood is coming from my mouth. The thing is that blood only comes when there are debris or food particles that they get stuck between the gums and the teeth. So between the teeth and the gums, when some foreign object is there, the gums get swollen, and when we touch them, bleeding is there. So no need to get scared while seeing the blood. It is just the first sign to indicate that gums problem has just started. So as soon as the blood starts coming from the gums, we should clean that area more. We should take it as a like indication that we are not able to clean this area properly, and now we need to clean this area more. And usually, what happens? It is the other way around. People start even stop cleaning that area. Some patient comes, they said we are now cleaning our teeth with the finger only. We have stopped using the brush. No, you have to keep using the brush. Bleeding while brushing is the first sign of any gum problem. That indicates that we need more cleaning in that area. And you can get that thing checked with your dentist also. If some debris is there, he can always remove that debris and clean that area.
Sure. Another person has asked, is extra doing extra is safe before going for RCT?
I couldn't get doing.
Are tooth X-rays safe?
Yeah, teeth X-ray is totally safe. The radiation dose of dental X-ray is very less than the normal X-ray. Moreover, while doing the dental X-rays, we always put thyroid collar and the lead apron on the patient so that it is totally safe. Totally safe. No need to. In some pregnant women, when the lady is pregnant, then we are cautious about that. We limit the amount of access that needs to be done in the pregnant ladies. Otherwise, there is no need to worry too much. All the precautions are usually taken in every dental clinic.
Sure. So another question is, what are the precautions they need to take care post RCT?
Usually, when we do some procedure on a tooth, that tooth becomes tender for few days. So it is always advisable not to eat from that side, like the affected tooth, the side in which the root canal treatment has been done. Avoid eating on that side because when you eat, you will feel little bit pain. So that is the only precaution which we always tell our patient that avoid eating on this side and no need to worry. And small tenderness and pain will be there that will subside after 5 6 days. Don't panic कि root canal के बाद कभी pain नहीं होगा ऐसा नहीं है. Body takes some time to heal. So give it some
Mhm.
time. So it will heal.
Another question to you is that a lot of people they get RCTs done for their one to I know some few cases they got 2 times RCT done and then they feel because they got RCT done twice तो बाकी जो टीथ है वो भी सेंसिटिव हो जाते हैं और बार बार आरसीटी की भी जरूरत पड़ती है. Is it like that or is it a myth?
Actually, it is a myth only. Usually, क्या होता है कि the patient comes, like you said yourself himself, that patient come to the dentist when pain is there. They don't go for the routine dental checkup. And I will
Oh,
tell you, statistics have shown that if the patient comes to the dentist every 6 months for routine checkup, in 98% of the cases, there is no problem. Only 1 or 2% cases we detect problem and we tell the patient that it is an initiative, we need to do some filling. So now if the infection is more, so success rate of any treatment becomes less. Like I said, root canal treatment has a success rate of 95 to 98%. So if in some cases too much infection is there, that RCT treatment gets little infection after few years. And in those cases, the patient has to undergo the re-RCTs. And like you ask, it will spread to the adjacent teeth. No. In fact, RCT helps in preventing the spread of the infection to the other tooth because it is the treatment to control the infection. So
okay.
if infection is there in any tooth and we are not getting the root canal treatment, that infection will definitely go to the bone and to the adjacent tooth. So it is always advisable, and it is just a myth that it will cause damage to the adjacent tooth. No, it will save the adjacent tooth. So these things
Sure.
they will come to know with more dental awareness. So that's why these talks are always there.
And is it safe for the kids also because these days a lot of kids are developing such infections?
Absolutely safe. In my clinic, 4-year-old children they are getting the root canal treatments, and it is absolutely safe because the milk teeth, like people have a myth in their mind that milk teeth they will go, they will definitely. In fact, they have to go. Then there is no need to go for any treatment for these teeth. But we have to tell them these milk teeth they will go by the age of 11 or 12 years of age. And what will happen if the patient child is coming at the age of 4 or 5 years of age with pain? If we remove the tooth at this early age, so his permanent teeth will get stuck in the bone, or how will he eat for next 7 years? So we have to save that tooth for next 7 8 years. So root canal treatment, they are specialists for those also, and root canal treatment is absolutely safe in children also. In fact, it is done in 2.5 year old kids also, but in those cases we have to take some precautions.
Do they also require such treatments? I'm a little cautious. I wasn't even aware. So because of the milk teeth also have such infections they develop. Is it frequent?
Yeah, it's even in fact in today my clinic, 2-year-old child came and the complaint of the child was bleeding from the gums. Parents said she is not getting clean the teeth so much. So when we try to clean the teeth, she like वो नहीं कराना चाहती. Then I do say जब आपका बच्चा आपसे दांत नहीं clean कराना चाहता, then how will you expect that we will do the treatment in them? You have to teach your child all these things. So small
Oh,
kids they are coming routinely for these
sure.
dental
Actually,
treatments.
that actually has a lot of sense to it. Then, okay, so let's move to the other question that is RCT safe for all the diabetic patients because
Yes,
maybe
it is
I don't know
absolute.
if it is
In fact,
connected.
in uncontrolled diabetic patients, extraction sometimes is contraindicated because problem with diabetes is that healing takes a lot of time. In
Mm-hmm.
those diabetic patients, in fact, RCT is the safest solution. So RCT is absolutely safe in diabetic procedure, and it is the recommended and the most indicated procedure for the diabetic patients to avoid extraction.
Sure, sure. So my two last questions from you are quite common. I'm sure you are commonly asked those questions. This is for all the public. So how any person should actually take care of their teeth well on daily basis? Because a lot of people have the myth, which toothpaste to use, which brush to use, how do we do brushing? Maybe you can give some tips to all of them, and
Yes.
for kids also. So
Okay.
these are the two questions.
So my answer is every toothpaste is just like a soap. Whatever soap you use, it will help in cleaning the area. So toothpaste is just like a soap, except for some medicated toothpaste, like in I told you, some sensitive for cases in which sensitivity is there. Those toothpaste have some extra salt in them. Otherwise, you can use any brand of toothpaste, whether it is Patanjali, Colgate, Pepsodent, they are all same. For brushing, for children again, toothpaste, we some non-fluoridated toothpaste are there that are made by some all big companies. Colgate also makes, some other companies are also making. So kids, we can use those.
So they are edible toothpaste, right? Because they are not able to gargle much.
Yeah,
So are
because
they
they have
safe?
like all toothpaste, they have a fluoride content in them. But for the kids, they have a tendency to swallow the toothpaste. So we try to avoid giving them that toothpaste. So some brands are there, they make those toothpaste for the kids. They can use. Then for the brush part, there are different type of brushes are there. A lot of company makes the extra soft toothbrushes are there in which bleeding problem is too much, like the patient is having too much inflamed gums. But otherwise, best brushes for any like you, me, and other people is the medium soft brushes. They are the best brushes. Hard brushes, they again will tend to abrade the tooth structure. That is not recommended. Then there is a new type of brushes like they have in vogue, powered brushes, battery operative brushes. They are marketing in us,
Yeah.
and these people come to us also. Please, doctor, please advise this. But these two brushes are advisable for the old age patients, like those are having dexterity problem in Parkinson's or maybe some rheumatoid arthritis patients or maybe some handicapped patient. Otherwise, for a normal population, normal brushes are the best thing.
Hmm. Sure. And a
And
lot of
then
people do the brushing very tightly. Is it like बहुत ज़्यादा clean हो जाता है?
हाँ, नहीं नहीं
Or
वो
should we do it very
इन द
gently?
लॉन्ग रन उसमें क्या होता है, इनेमल लेयर कम हो जाता है एंड विद एज लाइक व्हेन दे क्रॉस 40 या 50 years of age, sensitivity problem starts a lot. In fact, my own father, there is a tendency that he used to brush it like in a horizontal fashion, so they just come around the gum and the teeth, so that causes sensitivity. Light gentle brushing in a vertical and circular motion, no horizontal motion on the teeth, so otherwise that
Sure.
will damage the enamel structure of the tooth. And teeth
So
will not
people who
become
have,
teeth will not
yeah, yeah,
become
please
white.
go ahead.
Sorry, teeth will not become white with the aggressive brushing. We need to
True,
clean the
that's
debris
true.
only. उससे तो ज्यादा येलो ही होंगे, नहीं तो व्हाइट नहीं होंगे, क्योंकि enamel, if enamel gets lost inside जो dentine है, that is more yellow in color, that will teeth will become more yellow. So
Sure.
normal
So as you recommended that people who have little sensitive teeth, they can use a little sensitive,
anti-sensitive.
paste.
Hmm.
So do you think that those kind of paste are regularly, I mean, we can use it regularly? Is it
Yes,
like that?
like there are
There's
no
no
side
harm
effects.
in that?
There is no harm or side effect of these medicated toothpaste. They can use it regularly, no problem. But if the sensitivity is too much, you please get it checked with your dentist. A lot of time
Then
patients
of
come,
course they need to see the doctor for sure. Yeah.
they come to us. We have been using it. We are applying this Sensodyne and all. We saw it on TV. But you need to get the root canal treatment of that. तो उससे नहीं ठीक होने वाला. But they are absolutely safe. There is no need to worry कि उससे कोई long term side effect होंगे. There is no side effect of these two. They
And
can.
how about the mouthwash and all? Is it safe? People do it these
Mouthwash
days.
are the adjunct to toothbrushing. Look, the main thing to clean the tooth is the toothbrush and the toothpaste. We cannot replace that thing. Mouthwash are the good thing because brushing that cleans the only the outer surface of the tooth and the inside surface of the tooth. So more than 40% of the tooth, which is the contact area between the teeth, that remains unclean. Our brushes, brush के जो brushes है, they don't go inside between the teeth. So that remains unclean. So mouthwash in those cases help in seeping through the gums and interdental contact and keeping the bacteria level of that area low. So they are good. No need to worry about that thing. But in the long run, we say why to take so many chemicals? Already everything is having chemicals, vegetable, fruits, and everything. So if you're cleaning
Absolutely.
your teeth, if you're cleaning your teeth properly, and then it's okay.
And two
एक
types
हमारे
of
टाइम
brushing is
जो
recommended.
हमारे जो फोर फादर दादा परदादा तो कहता है ना फिट करी के कुल्ले करने हैं वो एक
Right, right, right.
एलम एलम के यूज करने हैं वो चीजें बड़ी अच्छी होती थी बट दे आर नॉट अवेलेबल राइट नाउ दीस डेज so anyway mouthwash
True.
can be used at this in place of that.
Sure. Sure. And two types, जो two times of brushing वाला एक सब लोग follow कर रहे हैं आजकल, is it recommended for kids also?
Yeah. In fact, kids need more cleaning because kids have a habit of eating chocolate. तो एक चीज है apart from that chips लेने हैं कुरकुरे लेने हैं those things and this cheese. This in our time there was not so much junk food like cheese for pizza slice or sandwich. Cheese has tendency to stick on the tooth. Then these chips, that lot of variety of chips have come. In our time, lot
Yeah.
uncle chips used to be there. So they get stuck on the teeth. So it is always
Sure.
advisable for the kids. And in fact, good habits, if developed at an early age, they will only help them in future. So
Absolutely.
to
Absolutely.
avoid visit to your dentist for the problem, it is better you clean your teeth daily, twice a day. That is better than.
Sure. Wonderful, wonderful talking to you, doctor. It was really, really informative. And I think this is something which I really wanted to cover it up because n number of people have dental issues on daily basis these days, very frequent problems.
Maybe
So it
because
is
of
always required to have more
maybe because of
information about
lifestyle
this.
changes or food habits have changed. Maybe
Yeah.
awareness is also there. People are developing.
Sure. So thank you so much for being with us. I'll catch up soon with you. Thank you
Thank
so
you.
much for the
Thank you.
session.
Thank you.
Yeah, it was great.